Hello, welcome to my channel. My name is Dr. Daniel KOITATOI, doing health talks where wellness honors God. Today we'll be looking at diabetes, and this is basically an awareness video for this particular medical condition. Yes, so diabetes is a medical condition that affects one particular organ in the body, an organ called the pancreas, which is highlighted here in yellow so that we are able to see where it's located. So, Apostle Paul, like we've always done, we try to use biblical principles of health in our bodies. So, Apostle Paul alludes to the body being one whole with many parts, and each part having a specialized function. And he used this analogy when he wanted to bring home the message of us in the body of Christ being different parts of the body, and each of us is gifted differently, but all of us work towards the same goal. Using this example implies that in particular the body, our bodies, our physical bodies definitely exist as that we have different body parts, and each body part is specialized to support the rest of the body in a particular function. Now today we'll be looking at diabetes mellitus, which is a condition that affects one particular body part that fails to function appropriately. And then when this body part fails to function appropriately, the whole body is becomes sick, as Apostle Paul says. Now, I encourage us from this Bible verse that the scriptures encourages to seek healthcare, to acknowledge the fact that yes, in as much as we are supposed to be healthy, one particular body part can just go wrong, can malfunction, and it needs to be taken care of. Otherwise, the whole body will suffer. Diabetes is one condition that starts by affecting having this particular organ malfunctioning, and the entire body suffers. Now, today, pancreas is a part of the body that I don't believe it has a local name in our local dialects, because it's usually a very small part of the body that, unless you have done the human anatomy medicine, then you will encounter this. But in general, we hardly see this even in the ruminants, when animals. But I encourage us to understand where it's located, and usually this is the basic science of the human body, and the upper part containing the lungs, and usually the heart is in between here. That part is called the thorax, and that thorax is separated from the abdomen by this thin muscle layer called the diaphragm. Now, inside the abdomen, you notice this big purple-like organ called the liver, and then this is the stomach. That's the stomach, and then down there we have something called the spleen. Each of these organs have a specialized function. Now, the pancreas would appear here when this is a large colon, yeah? This rugged kind of organ, pipe-like structure. It's been moved out for you to be for us to see that yellow structure. So that yellow structure is called the pancreas, and that pancreas it usually lies beneath the stomach and kind of behind it towards the spine. Now, it is an accessory organ of the digestive system. Accessory organ meaning it's not part of the alimentary canal, but it exists next to the alimentary canal because it has a very important function of producing pancreatic juices and also hormones, chemicals that help us in metabolism of food, specifically glucose, as we shall see. Now, again, this same diagram also illustrates that yes, you have the thorax up there, and then you have the diaphragm here, and then now beneath the diaphragm you have all these abdominal organs where you have the liver, you have the spleen, you have the stomach, and then you have this, which the stomach continues as small intestines. It passes behind here, continues as small intestines, and then you have the large intestine. Usually the kidneys are also behind this part here at the back, and also behind the liver here at the side. Now, so what happens? Another diagram here. Just in this diagram, the liver has been moved out for us to be able to see the pancreas clearly. The liver has been moved out of the way, and the stomach also. So basically, this is where the pancreas will lie. This is where the pancreas will lie, and it's a very deep organ in the abdomen. In the abdomen, you cannot feel it when you're trying to figure out if there's any swelling, if there's an abnormality. It's not easy to pick it. Now, so again, this is the same structure. This is the same diagram illustrating the position of the pancreas in relation to these other organs, very important organs, the spleen and the liver. So today we'll be talking about the pancreas and its role in the human body. Now, pancreas primarily helps in metabolism, helps us in the use of glucose. Glucose is the raw material that we use to make energy. Okay, whatever you take, chapati, ugali, rice, anything, as long as it's generally a carbohydrate, it is metabolized in the intestines to give us the raw material called glucose. So essentially, this is what the body will use to make energy, glucose. But now, after it has been absorbed from the intestines to the blood streams, where it is taken round to supply to the rest of the body, now we will need insulin. We will need insulin so that the insulin now takes it up from the bloodstream. So the insulin takes up the glucose from the bloodstream to the body cells. Okay, and if the body cells probably don't need it to make energy at that point in time, it's taken to the liver for storage. Okay, that glucose is taken to the liver for storage, and that process also requires insulin. Okay, and then not only the liver, it can also be taken to the subcutaneous fats, to form fats for storage also. So but if you need muscles to make energy at that point in time, maybe for movement, or even for reproduction, or even the brain cells requiring energy, glucose is very essential, and that is enabled by insulin. So this organ called the pancreas will produce that insulin, and then that insulin will now remove the glucose from the bloodstreams and takes it to the rest of the body cells, or take it to the liver for storage, Okay, I don't want to talk about this part, this lower side, which happens usually whenever we have a low blood sugar, because also the pancreas produces another hormone that helps us to bring up a blood sugar, especially if you're fasting and you've not taken food, so the body takes care of itself. Now, so what is diabetes? So diabetes is when that diagram that I've shown you, when it malfunctions. So you have shortage of insulin. Okay, so the pancreas is not producing enough insulin, or it's producing insulin, but there is a low sensitivity of the insulin in the body. The insulin is not sensed by the body cells. Okay, it's not functional. That insulin is not functional. Okay, so you're saying insulin is a hormone that will allow us to take up the glucose from the blood streams to use it to make energy. So this glucose has landed here because you have taken food. Okay, so initially it was low, you took food, it became normal, but now if it is not utilized at this point, then it accumulates and become more. That is what we call diabetes, as illustrated on this diagram. Okay, now when diabetes is not controlled, when high blood sugar is not regulated, is not brought down, then this high blood sugar is dangerous to the body organs. One, you're not even utilizing it. You're still like you're fasting. You're not taking you are taking food, but you're not benefiting from the food that you are taking, because that food is not reaching to the body cells that need that energy, the muscles, the brain, the reproductive organs, the kidneys, they are not, the body cells are not utilizing it. Okay, so now even if it is there, it is stuck in the blood vessels, and it is also dangerous if it accumulates beyond particular levels. Okay, now again, so what goes wrong? We have said that what goes wrong, and basically what happens is, based on the two concepts that we said, you can have absence of insulin completely, and you can have an insulin that has been produced but is not functional. Those concepts are used to give us different forms or types of diabetes. Okay, so diabetes can be called type 1. Okay, type 1 is when essentially the pancreas has completely failed and is not producing it's not producing insulin. Okay, it's not producing insulin. This type 1 diabetes, so you realize that someone takes food, okay, and that food is digested in the stomach, in the intestines, and it is converted to glucose. This glucose enters into the blood streams. Okay, so if it enters into circulation, now from circulation it has to be taken up by the body to be used. Okay, it has to be taken up by the body to be used, and that can only be done with the help of insulin. Okay, so if insulin is not there, then you are not utilizing that, and it accumulates in the body. So you realize here this guy is not producing enough insulin. Okay, if basically we needed one particular yellow dot for one particular blue dot, then you see insulin is very little at this point. Okay, so you are not getting enough insulin, that is needed to release, to utilize all this glucose that you have put into the blood circulation, because this insulin will be meant to take this glucose to the muscles. This insulin will be meant to take this glucose to the liver for storage. So if you don't have this insulin, then we accumulate the glucose in the blood vessels. Okay, now in type 2 diabetes, this is again the normal. You have taken food, and then that food is digested to glucose, and glucose is absorbed directly. Absorption of glucose from the intestines to the blood does not need insulin. Okay, but as soon as this glucose is in the blood, then the pancreas should sense that and give us insulin. Okay, and then so that glucose does not accumulate in the blood, but rather it is carried along by the insulin to the muscles or to the liver. Okay, that's again what should happen normally. Now in type 2 diabetes, you are producing insulin. Okay, you are producing insulin that is commensurate or in the same level as the glucose that you have taken. Okay, but this insulin is not functional. It's not being sensed by the body cells. It's either defective or the body cells have become defective, so they are not sensing that insulin. Okay, so normally you have this glucose that has entered into the blood, but we are not taking it out of the blood, because this insulin is a lot, but is enough, but it is not functional. It's not functional. Okay, and this type of diabetes is called type 2 diabetes. So type 1 diabetes is normally seen with young adults, children, okay, and youths and young adults below the age of 30. It's commonly type 1 diabetes. Past the age of 40, it's usually type 2 diabetes. But now we even see patients with at the age of 30 developing type 2 diabetes. Okay. Another form of diabetes is gestational diabetes. Gestational meaning diabetes that occurs in a pregnant mother. Okay. A pregnant mother, once we have a fetus, a fetus growing a baby growing in the womb of the mother, there's usually a natural way to try and make more glucose for the baby. Okay, so normally there are hormones or chemicals produced by the placenta to try and make the mother insensitive, okay, of her own glucose, so that she's not utilizing her own glucose. Okay, but to make that glucose a little bit more in the mother's circulation, so that it is able to reach into the placenta. You see? But now, if that becomes too much, if that becomes too much, then we pick that in the blood in the blood system of the mother, that there's a lot of glucose in the blood system of the mother. Okay, and that will be called gestational diabetes. Usually after delivery, this tends to the sugar levels tends to normalize. Okay, but it's an important concept that we look at when we are talking about pregnancy and pregnancy conditions. Okay, now, so either way, whether it's type 1 or type 2 or even gestational diabetes, there are specific symptoms that you can pick out in a diabetic patient. Okay, so diabetes is usually, like we've seen, that it starts slowly by slowly. There are no symptoms at the beginning. Okay, there are no symptoms at the beginning. Okay, usually around 40% of patients who have diabetes do not even know that they have diabetes. Okay, but what are these symptoms that we will notice from the beginning, or when the diabetes starts progressing? Now, the sugars is that is too much in the blood vessels is usually released from the kidney in the urine. Okay, and normally when it is released in the kidney, from the kidney through the urine, then you have a lot of sugar in the urine, and that lots of sugar in the urine pulls with it the water. So, because remember the concept of osmosis. Okay, osmosis. So if you have salt or sugars, it pulls the water. Okay, so that's why now, because this glucose will be released in the kidney, it pulls with it the water, and if it pulls with it the water, then urination becomes too much, too repeated urinating so frequently. Okay, now, then because you're urinating so frequently, you're losing water and you get increased thirst. You become very thirsty. You want to take a lot of water, so you're taking a lot of water and you're urinating a lot of water again. Okay, and remember, you are taking food, but this food is only reaching into the bloodstreams, and probably it only goes to the kidneys, and it is lost through the kidneys. Okay, so you are eating, but you are still feeling hungry, very hungry, because you are not benefiting from what you are eating. Okay, and you are still tired. You are eating to get energy, but you are not getting that energy because the glucose or the raw material to make energy is stuck at the blood vessels. Okay, it's not entering into the blood cells, I mean into the body cells for this for the body to use it to make the energy. So you are still fatigued, you are still tired. Okay, and you lose weight. Why? Because in fact, when you are hungry, the body is assuming that you are not even eating food. Okay, so now the body starts taking the stores of the glucose that were there, the fats, the stores that were in the liver, and it produces more glucose. Okay, because the body is sensing as if you are not even giving us food. Okay, like as if you're fasting. Okay, so you get sudden weight loss, and blurring of vision. Sorry, blurring of vision comes in later. I should have put down here. But now, blurring of vision will come in when the diabetes starts advancing. Remember, I said when the glucose accumulates in the blood vessels for quite a long time, it affects all organs, like the way high blood pressure does. Remember, blood is going through all the organs of the body. Okay, so if you have glucose, that is a lot of it in the blood vessels, is damaging the blood vessels. Okay, it will damage tiny blood vessels in the eye, so you get blurring of vision. It damages the nerves. Okay, so you get numbness, you get like loss of sensation. Okay, it damages the skin, and when you get a prick or a wound, it takes long before it heals. Okay, and then it also affects the sexual function, affects the erectile dysfunction for men. Okay, so diabetes is very dangerous. It's also deadly because it affects all those parts of the body. Now, and it also affects the kidney over time. I want us to look at how we diagnose diabetes. Okay, so we'll rush through how to diagnose diabetes. So basically, diabetes, a patient will come just because probably they complain lately, they pass so much urine at night. Okay, then the doctor would want to do what you call a fasting blood sugar. So it is usually diagnosed generally by testing the sugar levels in the blood. Okay. Now, if we do sugar levels in the blood, we do it in there are several types of it. We try to look at a fasting blood sugar. A fasting blood sugar is we want you to have fasted for at least 8 hours to 12 hours without taking food. That implies you should have a low level of sugar, okay, because you've not fed. Okay, so if you come, we expect your sugar to be between 3.8 to 6.1 millimoles. Okay, now if it is beyond this, then we are worried. Okay, so what happens, or you can also have a 2 hour postprandial, like you take food and exactly after 2 hours you we test the blood glucose levels. Okay, now what happens, so if we do a fasting blood sugar, the normal should be below 6.1 and of course should be above 3.8. Otherwise, if you go also too low, it's very dangerous. We'll look at that also. Now, but if you have between 6.1 up to 6.9, you are not diabetic. But it raises eyebrows because you have a highly likelihood of developing diabetes. If you are having a fasting blood sugar of between 6.1 and 6.9, you have a high likelihood of developing diabetes. And you are not yet diabetic, you don't need any treatment for diabetes, but you need to be very cautious and you need to take care of your health, change the lifestyles, but you are not yet diabetic, but it raises eyebrows for a likelihood of developing diabetes. Now, type 2 diabetes is when now we do a fasting blood sugar and we notice it is above 7. Okay, if it is 7 and above, then you are diabetic. Okay, you're diabetic. Now, what about a 2 hourly postprandial measure? A 2 hourly postprandial measure, we measure the blood glucose levels. This is again the fasting blood sugar levels. I've already explained that. Now, this one here tells us what about the 2 hours. You can come and we say, okay, take a meal, okay, and come 2 hours later, and then you do a blood level. We expect at within 2 hours, because when you take food within 2 hours, that glucose should have gotten into the blood vessels. Okay, and in the blood vessels, the insulin comes along with it and the sugar is taken away. Okay, but if when you come, then the blood sugar must be below 7.8. Okay, remember it's higher than 7, it's higher than 6 because you had just taken a meal. But after 2 hours, then the body should have already started using up that glucose, or taking it away for storage. Okay, but now if you come and the glucose is still within 2 hours, it is still between 7.8 and 11, then you are not diabetic, but you have a low response to the glucose in the blood. The insulin is not working very fast as we expect it to do. Okay, so it's called a pre-diabetic status, okay, or a glucose intolerance status, okay, because you are not responding the way we expected you to respond. So within 2 hours, the sugars should come below 7.8. If I do within 1 hour, probably it will even be at 10, at 11. Okay, but after 2 hours, it should go below 7.8 because you have started utilizing the glucose. Okay, now diabetes is then diagnosed if we take a blood sugar 2 hours after taking a meal, a carbohydrate meal, of course, and then your blood sugar is above 11.1. Okay, 11.1. Now, a random blood sugar is another test that can be done. It's usually just you walk in, you're not feeling good, and the doctor says, let me see what's your blood level, what's your blood sugars level, because one can be fatigued, one can be sweating, and it's really a very important baseline test to know if we are doing well. Now, a random blood sugar cannot be used for diagnosis. However, it is very concerning if your blood sugar is above 11.1. It actually gives us a diagnosis. But there are several other things that can give us a random blood sugar that is above 11. Maybe an illness, an acute illness, maybe some drugs that you are using. Okay, but that is not to say a high blood sugar does not tell us about your diabetic condition. It does. It does tell us, because if you have a random blood sugar that is above 11.1, you are likely diabetic unless there is any other condition that can be treated to bring the blood sugar down. Okay. Now, we don't use it to tell us if you are pre-diabetic or not. And the normal random blood sugar must be below 11.1. Okay, must be below 11.1. Okay, now there's another very important test that is done that is called a HbA1c, glycosylated hemoglobin. HbA1c is the test which is used to confirm if the blood glucose has been elevated for over a period of up to 3 months. You come and if you walk into the hospital and the doctor finds out that the random blood sugar is elevated, it's not confirmatory that you have diabetes until we look at how has the average been for the last 3 months. Okay, so a HbA1c is used to confirm if the glucose has been elevated for quite some time. Okay, and the most important test also that is used in monitoring patients who are being treated for diabetes. This is the most important test that we use to know if the medications are working or not. Okay, normal levels should be less than 5.7% percentage, because you're talking about the hemoglobin level that is bound to glucose. Okay, now it has to be below 5.7%. If it is between 5.7 and 6.4, then if you are not diabetic, then in this case we will look at you as you have a high likelihood of developing diabetes. Okay, if the HbA1c is above 6.5%, that tells us you have had high levels of blood sugars for the last 3 months, and the random blood sugar that we found today is not likely acute, but it confirms that you are diabetic. Okay. Now, another test that is done is an oral glucose tolerance test. An oral glucose tolerance test, you walk into a hospital and then you are given a drink of glucose. Okay. It's more or less like a 2-hourly postprandial test. This one, you are given a particular amount of glucose to take, and we measure the blood glucose level after 2 hours to see how much it is in the blood. And if you are not taking up, then we also make an impression of probably you have an intolerance, a glucose intolerance, or diabetic. This is commonly done with pregnant mothers, but can be done to anybody. Okay. Now, I said that HbA1c is a very important parameter to monitor for optimal control of diabetes, or of sugar levels in a diabetic patient. So now, if the HbA1c, remember I said, if it is above 6.5, then you are diabetic. Okay, but if you are diabetic and your HbA1c, you're on medications, and your HbA1c remains at 7 and below, then it is very good, and we have achieved good control of the diabetes. Okay, the problem is if we start hitting 8, 9 and above, HbA1c, if you walk in after 3 months, do a HbA1c. If it's above 8, we are not doing good control, but at 7 and below, it's okay. Above 7, we are not doing very well. Now, random blood sugar, we also do random blood sugars. We'll want them to be at least 10 and below. Okay. Now, so what are the risk factors for developing diabetes? We've looked at type 1 diabetes, we've looked at type 2 diabetes, and gestational diabetes. Gestational diabetes, any woman has got a likelihood of developing gestational diabetes. Okay, because you remember I said it's a normal physiology that tends to go wrong, and then too much of sparing of glucose for the baby. Now, in type 1 diabetes, the risk factors are usually commonly genetics. Remember, I said we develop it from childhood and children and young adults. Okay. Now, for type 2 diabetes, I look into the risk factors because at least we can do something to avoid developing type 2 diabetes, because type 2 diabetes is brought about by most commonly our lifestyle. Okay, our lifestyle. But there are unchangeable risk factors that we cannot do anything about, especially age. We said at the age of 40 years, anyone has a likelihood of developing diabetes if you continue living recklessly and eating unhealthy diet. Okay, a family history. You have a parent, a brother, a sister who have had diabetes type 2, you have a likelihood of developing diabetes. Okay, genetics is a family history. There's a genetic predisposition, so that's why a family history falls in place. Okay, a history of gestational diabetes. If a mother has had gestational diabetes in pregnancy, she has a likelihood of developing type 2 diabetes. Polycystic ovarian syndrome, this is a condition that usually presents with irregular menstruation periods, infertility in women, and it has a likelihood of causing, it has a tendency of causing insulin resistance, that's resulting in type 2 diabetes. Okay, those are the things that we can hardly do nothing about them. But now, for the modifiable, or rather the changeable factors, overweight. People think we don't have control of our weight. You should have control of your weight, because obesity has been associated with insulin resistance, and that's type 2 diabetes. Okay, physical inactivity, sedentary life, office worker, people working at home, from home, I mean. So we need to make sure that we have activities like at least 30 minutes in a day. Okay, so that you have a brisk walk, you have sweating, you have burning of these calories, so that when you work out like that, even the sugars from the blood are taken up for used to make that energy, and you burn up that. Okay, unhealthy diet, we'll look at that. High blood pressure is a risk factor for diabetes. High cholesterol, smoking, and use of alcohol. Use of alcohol has a direct impact on the pancreas, and use of alcohol has a tendency of giving us a mixed picture of type 1 and type 2, because it has a direct damage of the pancreas. So it's not only about the insulin becoming defective, but it's also about not producing enough of the insulin. Okay, so those are the things that we've said. We talked about family history, talked about being overweight, talked about being inactive and having a sedentary life, we talked about having high blood pressure, we talked about having high cholesterol, we talked about a history of gestational, we talked about gestational diabetes, we talked about age, over 40 years of age. Okay, and we talked about healed eating and healthy foods. Okay, now what are the complications? Okay, what are the complications if one develops diabetes? Complications are not symptoms. Urinating a lot at night is not a complication, that is a symptom. Complications are the worst things that can happen to the body if the diabetes is not managed. Okay, if the diabetes is not managed. Okay, and these complications are separated into two major types that affect the small blood vessels, and the types that affect the big blood vessels. Okay, the small blood vessels like capillaries. Okay, for example, in the eye, in the kidney, and in the nerves, those ones affect them and give us problems in the eye, problems in the kidney, and problems in the nerve. So you get that of numbness and loss of sensation. The big vessels are the vessels that can give us stroke, a blockage of blood vessels in the heart, and you get diabetic cardiomyopathy, or a heart attack, or extremities, just the legs, vessels in the legs getting blocked. We'll look at that. So starting from the eye, now, this is the retina, like we've looked in another picture. This is the retina. So the retina can give us, the retina has small vessels here. Okay, so the retina can have these small vessels, and they can rupture. You see, if there is a lot of sugar in them, if there's a lot of sugar, if there's a lot of cholesterol, it blocks these blood vessels, and the retina dies off slowly by slowly, and that's why we get blurriness of vision, blurring vision. Now, cataract. Cataract is whiting of that, the white, a white appearance of the pupil. This one here, okay. So if you have the white appearance of the pupil here, this comes as a result of glucose, okay. This comes as a result of glucose, okay. Now, this one usually tends to develop also with age. Cataract tends to develop also with age, not necessarily being a symptom of diabetes. But if you see it in a young adult, then most likely that patient has got something else just beyond cataract. Okay. Now, I've already talked about the retina becoming dying off from the rupturing of these blood vessels or the blockage of these tiny capillaries. Okay, the blockage of these tiny capillaries. Now, so that's why a diabetic patient who can turn blind because the retina dies off. Okay. Now we have the kidneys. So look at that beautiful kidney, but look at this kidney that of a patient who has diabetes. This happens if the diabetes is not controlled. Remember, if the HbA1c is above 7, okay, if the random blood sugars are always above 10, okay, always above 11, okay, okay, and if your fasting blood sugars are always above 7, okay. Now, so we need to take care of this. Now, this is again another effect to big vessels in the leg. So if you have a blood vessel in the leg and it gets blocked, so when this vessel gets blocked, then blood is not reaching to the toes. Blood is not reaching to the foot, and this is an imaging called a CT angiogram to look at the blood vessels and how far they are going. Okay, and usually you see that for a patient who has developed numbness, drying of the foot, and the foot losing sensation, if you do this, then you can always see the blood is not reaching to the end. Okay, it gets somewhere here. This is a dye, like a chemical that has been added into the blood so that we're able to see from the CT scan. Okay, now look at that, and then the blood, the foot just turns black like that, dies off, necrotic, and it dies off completely. That's this, the doctor is trying to feel for a pulsation of a blood vessel that is supposed to bring blood here, and usually it will be absent. Okay, usually it will be absent, and what happens, you start getting this cutting off like that. These are actual photos. You can listen. These are actual photos of patients with diabetes that has not been well regulated. Okay, well regulated. Now, I had mentioned this status where you are not diabetic, but you have a likelihood. You have a likelihood of developing diabetes. This is at the point where you have a fasting blood sugar of 6.1 to 6.9, okay, or a HbA1c between 5.7 and 6.4. That tells us that you are not yet diabetic, but you have a likelihood of developing diabetes. There are no symptoms at all, but in this case, please make sure that you regularly screen for type 2 diabetes every year and do changes on the lifestyle. Okay, on the lifestyle. Now, this again where the normal HbA1c should lie, 5.6 and below. Between 5.6 and 6.4, there is a problem. You need to work out. You need to prevent progression to 6.5 and above. Now, how then do we prevent type 2 diabetes from a pre-diabetic status? Okay, so early treatment and lifestyle changes can return blood glucose to normal. Okay. Now, how do we do the lifestyle changes? Well, it has been noted that type 2 diabetes likelihood can be lowered when one loses 5 to 10% of their body weight. Just take your BMI, just take your body mass index below 25. Okay, from here, like, so just have to have your BMI between 18.5 and 24.9. This is a situation that can give us a pre-diabetic status. This is a situation that can give us a diabetic status. Okay, so by losing 5 to 10% of the body weight, by that when your blood tests are at pre-diabetic state, then losing body weight can take us down to normal. Okay, now appropriate dietary plan to avoid high intake of refined carbohydrates. Okay, carbohydrates that do not have any vitamins, they are not fortified, and they are the direct carbohydrates only, or processed food, the chips and the sausages and all that. Okay, now these are the things that you need to avoid if you are pre-diabetic, to prevent yourself from progressing to diabetes. Okay, now, and these are the things that you can befriend and take them. Okay, now, exercise moderately, 5 days a week for at least 30 minutes per day. Get a brisk walk, or just to exercise to burn the calories and move out the glucose from the bloodstreams to the body cells for energy. Okay, now I want us to look at hyperglycemia and hypoglycemia. Hyperglycemia is usually a tendency whereby the sugars are higher than normal. Okay, and hypoglycemia, I'm talking to now a situation whereby you could be having diabetes, and you occasionally find sugars being high and sugars being low. Okay, okay, now hyperglycemia is an excess of the glucose in the blood. Okay, and it's usually due to inadequate management of the diabetes, or you have just taken too much of the sugars at a certain point in time, and then you have high blood sugar. Okay, now you could also be having so you look at that, it becomes very high. Usually onset is very slow. It just starts slowly. You're urinating a lot, you are a bit tired, you're a bit fatigued. Symptoms are just the same as those of having diabetes, because basically this is actually the presentation of diabetes, hyperglycemia. Okay, but there are medical emergencies, things called DKA, diabetic ketoacidosis, and HHS. These are things that can set in suddenly if the blood sugar is very high, and will normally require ICU management. Management in not just in the ward, but in ICU. Very dangerous. How do you avoid that? Make sure that you are testing your blood sugar, and revise your medications with your doctor. Make sure that you avoid going high, and with your nutritionist also, to get the right diet, to make sure that you avoid going high. Okay, what about hypoglycemia? Hypoglycemia is when the sugar is low. Now, hyperglycemia is dangerous, but hypoglycemia can kill instantly. Okay, when the blood glucose is lower than 3.8. Okay, now this is having either too much, you have taken the insulin and you have not eaten food. Okay, or you've been working out, burning a lot of calories, burning a lot of glucose, but you have not taken food. Okay, now it's usually very sudden. One may pass out if it is untreated. In fact, there's also a range. Like, if it is below 3.8, it is low blood sugar. If it goes below 2.7, one can pass out. Okay, and it's a very, very a very bad emergency to find yourself in. And that's why you should tell us how do you sort it out. So again, we're saying the symptoms are anxiety, sweating, increased heart rate, dizziness. That's how you have the hypoglycemia. Okay, that's how you have the hypoglycemia. Okay, okay. Sorry about that interruption. So I was saying, in hypoglycemia, you can have you have to do something instantly, even while being at home. So there's something called a 15 by 15 rule, where you are usually advised to first of all test your blood sugar, see how low it is. Okay, and then get at least 15 grams of a fast acting carbohydrate, a soda, a chocolate. Okay, 15 grams of it, and then wait for 15 minutes and repeat the test of the blood sugar. Okay, make sure that your blood sugar at least gets to above 3.8. This is the cutoff, at least above 3.8. Maybe you found yourself at 2.7, 2.6. Please resuscitate yourself by getting at least 15 grams of. Remember, we don't want to go all the way, so that's why we are doing bit by bit and retesting, bit by bit and retesting. So you do 3.8 and test it again. You do 15 grams. After 15 minutes, you test and repeat that until your random blood sugar is above 3.8. Okay, and immediately after that, you follow up with the doctor. Find out what happened and why did you get an episode of hypoglycemia, and how do you avoid that? How do you avoid that in future? So uh, these are falsehoods that we need to debunk, to to tell us the truth about. So please, diabetes does not necessarily mean that you are doomed to developing it. You can do something to prevent development of diabetes. Even if we have said that if you have a family relative that has had it, then you have a likelihood. It does not mean that you are doomed to getting it. You can do something about it. Even the weight, you can still lose it and do something about preventing it. You have control over it. And also, the sad news is that there is no magic pill to solve the diabetes problems. We have seen a lot of clients dropping their medications and taking herbals and taking, a lot of things are out there. There is no, and I can say this without any fear of contradiction, there is no magic pill, a tablet that can revert back all that diabetes, okay, all that sugar intolerance. Remember, we said a certain organ in the body is not functioning properly, okay. So there is no way you can take a medicine that goes to revive the whole organ, okay. We don't know what happened to it. We don't know why it stopped working. Probably sometimes it is autoimmune, okay. Probably sometimes it has been a long-term damage by alcohol, okay. So there is no particular pill that can reverse that. So diabetes is just that now you know that the pancreas has stopped working properly. Now the pancreas is in the brain and I need to control my sugar levels. And when you optimally control that, you have your full life to the fullest, okay. So time is an important element. Please attend to it before it's too late, before the kidneys are damaged, before the eyes are damaged, before the blood vessels are damaged. Do the right thing from the beginning, okay. Please pick out any pre-diabetic state and do something before it develops into diabetes, okay. Now thank you so much, and that is all about diabetes and its complications. I'm very happy to have taken you through this, and in the next video we'll be looking at pregnancy induced hypertension. I'm just doing these topics based on how people request me to cover them. I'll be looking at pregnancy conditions, including pregnancy-induced hypertension, gestational diabetes, and many other conditions around pregnancy. And I encourage us to subscribe and like and comment on the videos and share to create awareness and make the population much educated and easier to manage. You know, it's very easier to take care of a patient who knows and understands their own selves and their own condition. I usually tell clients most of these non-communicable diseases, you are your first doctor. When you manage yourself, because even if you are prescribed lifelong medications, you determine to use them or not to use them. You know when to see the doctor and when to follow up with the doctor. Please, this is about you and for your health and for your own benefit. Thank you so much, and may God bless you.